Thank you all for joining us today. We are excited to have folks tuning in from across our industry, across the US, and even a few global participants as well to hear more about healthcare consumerism. I'm Michael O'Neill, the founder and CEO here at Get Well, where we have a particular interest in consumerism from a healthcare perspective. As people worldwide grow more and more accustomed to having a say in the services provided to them, from airline travel to hotel stays to restaurants and other retail services, we at Get Well are embracing the changing expectations of our patient consumers. Increasingly, patients are calling for hospitals and health systems to rise to the challenge as they seek the kind of consumer experience in healthcare they can get in other industries. Today, we are working alongside organizations across the world to catch up in some cases and to get ahead of the curve in all. Leading our discussion today is one of Get Well's executive leaders, Todd Strickler, a partner and a friend. As our Senior Vice President of Product, Todd heads up a talented team here at Get Well that's building the future of healthcare and virtual care delivery for today's consumers. Todd is here today to talk about the ongoing digital transformation of the healthcare industry. And we've asked him to speak with you because he knows a little something about this consumer mindset and how it integrates into digital experiences. Todd has a background in consumer-oriented digital transformation that drives top-line growth and moves industries forward. He has done it in telecommunications, in payments, and hospitality. He's intimately familiar with today's topic of consumerism because he's lived it and he's helped shape it in multiple industries. This is Todd's true passion. Prior to joining us here at Get Well, Todd was the Vice President of Mobile and Digital Customer Experience at Marriott International, where he spearheaded Marriott's transformation into a digital travel leader through the reimagining of its mobile and on-property digital experiences. As an avid business traveler myself, I certainly have benefited from Todd's incredible work. As a result of this work, Marriott saw significant increases in both digital revenue and usage across its global portfolio of brands and hotels, and witness a robust lift in guest satisfaction. In other words, Todd knows what it means to get at the heart of what consumers are looking for. It truly, again, is his passion and it's been his life's work. If you've ever used a digital wallet or a mobile payment system, you should know that Todd was there from the very beginning, co-founding SoftCard, which was a joint venture among the leading US wireless carriers that turned smartphones into mobile wallets. SoftCard was acquired by Google in 2015, and we've all been using and benefiting from that consumer-centric technology ever since. Today at Get Well, we're thrilled to have Todd in our camp, our Purple Camp, and he is helping organizations and healthcare providers compete and win in the next generation of consumer-driven healthcare. And with that, I'm very excited to listen to him. And Todd, happy to have you here. I'm going to turn it over to you now.
Great, thanks a lot, Mike O'Neill, and thanks for that background. I'm still learning healthcare. I've been with the organization now about 12 months, and I've got a long way to go on that side. But to what Mike shared, my background is in the consumer digital space, and I like to say that I'm a dinosaur in that space, going back to the days before you could send a text message between an AT&T phone and a Verizon phone. Back in those days, only 0.5% of users even sent a text message. If you go to the next slide, that paradigm has changed quite a bit, and I'll get to that in a second. But if there's one thing that you should take away from this session today, it's mindset, and it starts with the consumer mindset. I chose a quote here from Sir Richard Branson and his Virgin ecosystem that now extends into space. Who was one of the pioneers of this way of thinking of the world, of serving consumers and taking existing industries and existing services and making them more consumer friendly in ways that people care about. And the thought process that drives the mindset is working your way outside in from the consumer's perspective, somebody that's actually using your services, and understanding what they're ultimately expecting, and try to meet those expectations and push yourself to exceed them. And it sounds really simple, but it does start with the mindset of working your way outside in from the way that consumers would see the services that you're providing. If you go to the next slide, to the paradigm shift for consumers today, it ultimately does come down to, for most consumers, the time they have available that is precious, and the money that they have available to get value from a service that they're looking to consume. And the expectations for that continue to rise every year. When you put it in the context of consumer digital, back to the data point that I shared back at the beginning of this chart in the lower left corner, 0.5% of people at that time used a text message. The first point to reframe how you think about consumers today is that 0.5% is now 97% of US adults who own a cell phone. And that's across all age ranges. And increasingly, most of those people also have a smartphone, which is essentially a computer in your pocket. And we've seen that adoption even within our processing experiences. We actually have people as old as 100 downloading our app to use to power their hospital stays. And so we know that this is a paradigm that applies to almost every consumer across almost every segment. And the leaders that set the pace for that are the major consumer brands that you see shown in the middle of the page on the right, Apple and Amazon and Google and Facebook. They effectively are the platforms that consumers are using to power their experiences in the digital landscape. And ultimately, they set the stage for where consumers are going next. If you go to the next slide, what you should also expect is that those expectations that consumers have are being shaped all around them from all of the industries that they utilize products and services from. And particularly in the COVID period, over the last 18 months, we've seen a notable uptick in further adoption of digital services across industries, with consumers across banking and entertainment and ordering food from the grocery store and having it be delivered to the house, buying your clothes and having them shipped to home. Some of it was obviously born from necessity, but the amount of users that have entered the space of adopting digital has increased in a pretty notable way. And it's important to look outside of the industry in which we operate to see that those expectations that are set are ones that transfer to us when we're serving them in our own context. This is not just to those industries. If you go to the next slide, it's obviously hit us in the digital healthcare space. And increasingly, we've been forced to operate in this digital mode for sake of delivering service when we frankly couldn't get people into care settings that were overrun or needed to be closed off from the visitations that we typically experienced. What has also happened in that context is a big influx of investment into the space, as everybody had to experience what it meant to be served digitally in the health care sphere. And that's led to a lot of investment that has come in. If you look on the left of this slide, you'll see the massive increase in investment from both a venture capital and an overall capital market perspective into healthcare. And on the right, you'll see an adoption curve of digital health services, particularly telehealth in this case, both visits and claims, that spiked and has not really returned back to prior levels post the heavy COVID period in 2020. And so what we should expect from both expectations set outside of us as well as within our own industry is for this desire and demand for digital health to be requested and demanded by consumers, but also other service providers that are coming into the space. And that sets the context, if you go to the next slide, for understanding the changed market in which we operate today. I came across this quote, which I thought was really a handy framing of understanding how much the market has shifted, the idea that every business will be a health business. And interestingly, not just in the US, but also globally, that happens to be the case in terms of healthy employees with companies at which they work, but also increasingly the interrelated nature of various industry services and providers in those spaces that look to accomplish the delivery of a seamless consumer journey across the sphere of services that are provided. And what that means by implication is that a number of players that we wouldn't typically think of as competitors in the context of healthcare are now showing up at the doorstep of providing services. And while it might seem at very basic levels in some cases today, that will increasingly expand and broaden as we go out into more of the healthcare space. Effectively, people that you didn't think provided healthcare in the lens of a consumer are now actually showing up. And so this is both a challenge, but also an opportunity for us that operate in this industry. If you go to the next slide. That sets the stage for the imperative of consumer and consumer digital as we think about healthcare. Let me talk about how to unlock the potential of this in the context of what we all do in this space. So if you go to the next slide, I'll share a couple of principles that I talk about with clients and generally in the space of consumer digital to mull over and think about applying in your own organizations. These might sound very basic, but I will try and translate them so you can see where there's some thought starters to run with. The first one is being human. And while this might, like I said, sound very basic, it's actually imperative back to that consumer mindset to look for opportunities on how to better connect with people to get them through the thing they're going through, on through that episode and on the health journey that we're ultimately trying to serve them on. And with that mindset, you typically want to start outside in, thinking on the lens of that person and what they're going through. The fun fact that I share with folks is that while healthcare happens to be the largest industry in the United States, with 20 million people that work in that industry, that still only makes up 6% of the US adult population. That means 94% of the people that show up into any number of healthcare facilities aren't affiliated with healthcare and don't actually know how it works. And so when they show up, in many cases, their context is in a very different light, in a very different place than what most providers are thinking about in terms of serving them. Sometimes the most important needs are very, very basic ones. And some of the guidance that's required is also very basic. And it's very easy to zoom past that when you're in the middle of a clinical episode and thinking about what to do in some pretty complicated situations. But the work to turn it into something that is human readable and human understandable on a basic level is something you have to fight for, and ultimately start from that point to make sure that you connect with the people that you're serving. If you go to the next slide, you also want to be able to take advantage of connecting to people in human ways with the vehicles that are available and the capabilities that are available to plus them up, if you will. And that's where digital shows up as the second principle. As I shared on some of the earlier slides, the adoption of consumer tech and digital technologies, generally speaking, is actually very high. So that means that there's a place to connect with consumers that you didn't think you actually had. And further, in the context of using digital to effectively erode walls and make things into services that used to be intermittent at different physical stops along the way, you can actually deliver a journey, a set of interactions that flow from one state to the next using digital technology to do that. In this slide, what you can see is that you can actually then connect that journey from somebody's home to the care setting that they might be going into and back home again. What that allows you to do is to follow the patient on their terms and where they're going versus the preconditions that are set by the facility they might have to go to. And digital in this way allows you to reframe how you go about serving a patient. And if you go on the next slide, the third principle to marry that with is caring. I actually use a lot of references from the time I spent in the hospitality space to talk about this in light of service. And as you've heard me talk over the last 15 minutes, I've used the word service quite a bit. That's because in a person sense, the service that they're getting with you, from you, and with their extended group that goes through the episode with them is ultimately what defines their experience and their perception of what they're going through. And ultimately, the more that you can translate clinical into service and orient it around simple principles of a wonderful warm greeting and a fond farewell, allows you to connect with people in new meaningful ways that changes the dynamic of that interaction from a transaction into a dialogue and a relationship that can continue beyond the encounter and the episode that might be experienced. So in sum, digital human caring are the bedrock principles that you'll want to think about applying in this consumer mindset to start transforming from the point of how you approach this and how that might then influence the services that you look to take in a different direction to better connect with consumers and build those relationships. If you go to the next slide. So now that we've talked about that framing, let's dig into it a little bit further. Go to the next slide. This is what we as a company at Get Well have been investing in, is putting together a couple of different products that can actually help enable and empower people to go on health journeys with the clients that we serve and take them from the point of having an initial interaction and engagement with the system and be able to follow through that episode and then beyond to start building a relationship that stays connected to that system beyond just the episode and onto a lifelong health journey. This is obviously not the easiest thing to pull off based upon the complexity of a lot of episodes that are serviced and what goes into them. But the mindset ultimately infuses across these into what we would argue is one of the most comprehensive set of capabilities for a consumer navigation platform, and one that we're pushing ourselves to help power what the next gen experience needs to be, and that ultimately a lot of health systems are looking to drive. If you go to the next slide. We've had a chance to work with some fairly progressive systems, and one that I have the privilege of sharing, Adventist Health, who we've been working with over the course of the last 6 months. Adventist Health is one of the leading health systems that we've seen that has adopted this type of mindset that I'm sharing with you today, to think about how you take somebody from a care episode into a health maintenance program, into a journey of well-being and a holistic view of the journey that you would go on going forward, and pretty ambitious plans that are pretty well laid out and simple to understand, to connect and wrap your digital arms around patients and connect to them in ways that are meaningful. And we simplified that into 3 areas that we work together on. The first is keeping patients in the system, finding ways to connect to people in really simple terms that hits all of the demographics. It's all of the places that we can encounter folks, and connect them to the care that they may be missing, that they might have forgotten to follow up on from either a primary care or referral, and be able to then come back into the system and make sure that they're staying on track for keeping their wellness. And then when they're in certain episodes, serving them better, using digital as a way to do that. Being able to have stays at the hospital that are mobile first, that make it easy to connect to the services and amenities that might be available to them, and then to follow them home with the information that will help them understand what they were going through, what they are going through, and how they can get to the other side and get better and stay on track. And in the process, be able to provide feedback, just like they do with other services. Let people know how it's going. Let people know where things could be better, where they've been great, recognize some of the folks that have helped them along the way, and be able to provide that back into the system to continuously getting better on the service levels that we can provide. And then to be able to reach out into the community and activate what might be under the banner of population health programs, particularly to communities that might be harder to reach and are traditionally underserved in many cases, and be able to connect to them in ways that allow them to get access to the right level of wellness programs, other kinds of outreach that can help those communities stay better and stay connected to take advantage of what's available to them in those communities. I hope to hear a lot more from Adventist Health in terms of what they're doing, and we look forward to doing a lot more together as we go forward. On to the next slide. I'll leave you with this. Common Spirit, Lloyd Dean, their CEO, has talked about how unique an opportunity that we have, particularly post-COVID, to recognize all the communities that we serve, and the opportunity that we have that has been highlighted through COVID and afterwards to rethink how we approach healthcare. And I'm hoping as we look forward that our ability to do so will take into account, starting from the consumer mindset, the ways that we can reorient our ways to the way that we serve our communities with ways to make those experiences better for people across all demographics and segments, and be more responsive to their needs as we think about making healthcare ultimately better for those folks. And I think the consumer-driven mindset and the application and smart ways of digital technologies will help to connect in different ways to build those relationships and activate more people on lifelong health journeys. And so with that, I appreciate the time that you guys have afforded me to share with you some of these insights with the webinar, and I open it up to questions from the audience.
Thank you, Todd, so much for that presentation. We'll go ahead and begin questions now. So our first question is, for many people, the choice of where to receive care is still determined by the insurance they carry. Can healthcare really become truly consumer-centric if so much of the decision-making process is still out of the patient's hands?
Yeah, that's an interesting question. You know, from my prior experience, I would say that healthcare will become more consumer-centric, whether the current industry paradigm likes it or not. I remember the same arguments in healthcare as I heard in financial services about 10 years ago, that was talking about how infeasible it was to change how services worked just from a regulatory perspective and how consumers viewed money and bank accounts. But if you fast forward to today and you think about the fact that you probably don't withdraw that much cash anymore, and you can pay with your phone at a retail shop in a contactless way, and you can Venmo someone some cash and split bills without needing to do any math to figure it out. A lot of players, Apple Pay, Venmo, Stripe, Affirm, Google Pay, others have turned payments into a more consumer-friendly service. I think COVID has unleashed the floodgates for healthcare. And there are players that are just starting now that will gear themselves around the paradigm of consumer health for getting through. And I think that consumers have experienced a taste of not sitting around in a waiting room to see a doctor for 7 minutes, thanks to COVID. So I expect that you're gonna find that consumers will find different ways to get their needs met, regardless of what they can get covered for or not. And while it might be limited in some cases, it will expand in others that are frankly in the important relationship entry points in many cases for healthcare, like primary care and urgent clinics and things of that nature.
Thank you. And we'll move on to our next question. You talked about using empathetic language to make your technology more approachable. What else can healthcare organizations or providers do to increase patient understanding of health information, which tends to be very complicated?
Yeah, that's a good question. So I go back to the consumer mindset because that's the important framing for how to approach not just language, but also what other things are going to be important to a patient working outside in from where their reference point is and how they're coming into the encounter, the episode, and then on to their health journey. Remember, as I said, that 94% of people don't work in healthcare. So they're not trained clinically, they're not familiar with medical terminology, and they don't know how to interpret diagnostic values in many cases, even though folks are pretty smart and they can figure stuff out. Remember too that they're often coming to you because they have a problem, and it's often too much to deal with on their own, or they wouldn't be coming to see you. So now they're coming into the healthcare system to address it, and they likely want to get back to a better quality of life, whatever their threshold of defining that is. So in this context, what healthcare organizations can do is reframe the problem space as to understanding how to help people get connected and feet on the ground as to where they're at in the moment. The next step that they can take very practically, some considerations for that they should think about and expect for the next step. And then doing that ultimately in ways that support with some additional information and pointing to resources that can help them get further educated if they really want to get grounded on what's happening, and pushing to try and do it in layman terms so that it's easy to understand by somebody that's not trained clinically. Now, I know this all sounds like a tall order, and there are many folks that actually do this extremely well, but it's finding yourself at the point of engaging in designing the service experience of this, and forcing yourself to think about it from the person's perspective, outside in of what they're likely going to go through at that point. That will lead to a bunch of opportunities that you'll find, in some cases, right at your feet, that you can start to improve what that experience might be for consumers and create more lasting relationships at a simple level.
Great. And our next question is, healthcare today can be very fragmented. Can you talk more about how digital technology can help make the healthcare consumer experience more streamlined and seamless?
Right, you're getting some good questions today. So digital technology, I think you should think of as a means to an end at the end of the day. If it's applied in a smart way, it's going to eliminate walls, and it's going to unify experiences in a way that's frankly better, smarter, and more convenient for people. I know in the case of healthcare, you're talking about multiple disparate players having to work together, sometimes in concert and sometimes across purpose based upon the dynamics of insurance and provider and different suppliers and producers in the mix. And yes, there is complexity to the fact that different episodes have varying levels of issues that need to be addressed and resolved amongst all those players. But ultimately, if you do start from the customer side of this and work your way to a place of pinpointing the problem spaces and the pinch points among those players, you're going to start finding that there are some problem spaces that you can attack, not just with digital technology for your contribution to that person going through an episode, but for ways that you can actually work in concert, even with friction to the cross purpose of different players in the dynamic of servicing an episode, that allow you to elevate the experience in ways that is meaningful and relevant for consumers. Keep this in mind too, from experience that I've had in other industries. The disruptors and competitors that are coming into the space are starting from that lens, and they're oftentimes doing this already. And they're bringing that with them as they push the industry in different directions. And know then that when they do that, they're going to set a different bar for expectations from consumers. And so your ability to out disrupt the disruptors in that case is going to help set you up for success as you go forward in this brave new world.
Awesome. And our next question is, have healthcare providers been able to lighten the workload of their frontline workers using digital health?
Have they been able to lighten the load? So they have been, in some cases, and in other cases, it's been challenging to maintain a certain status quo with the increased volume of encounters that have come in. One of the concepts that we've been sharing with some clients is the idea of patient-led rounding. And it's the idea that you can actually look to engage patients and their proxies as they come into the process to do some of the work as part of the experience that they'll gladly do if you make it something that's easy and fun and relevant to the thing that they're going through, to either complete certain tasks or provide feedback how the service is going. Something to keep in mind, and this is where we've seen success and we've seen challenges in other places, is that as you digitize, generally speaking, you start to create more opportunity for touches with clients, or sorry, with consumers. And when that happens, they look to increase ultimately their volume of interactions that come with it. The ability to make it something that drives dramatic changes is increasing the value of those interactions and putting more control in the hands of patients and the folks that help them out through the process so that they can actually complete things on their own. And when that starts to happen, you see the snowball effect that dramatically can change the profile of that workload. So that sets a context of, yeah, we've seen gains. We've also seen where the opportunity opens up the next stage of challenges to work through to fully see the value of this kind of transformational thinking.
Great. And for our final question, the medical industry is slow to accept change and still using fax machines and clipboards full of forms. Can this be modernized by today's standards of applications and web portals on both ends? Specifically, the medical practices. Independent medical practices are very poor with consumer satisfaction. Institutions need to do better because of more efforts and money.
Yeah, I'm not going to say that it's easy, but I will say that it is possible, and I've seen this really from some of the folks that are coming in from the outside into the industry to really push on new dynamics of how you do certain things. I would say when I put my outsider lens on, there's a lot of record keeping and processing that is due to either regulatory considerations or just ways that things want to be administered for efficiency of completing paperwork. But that activity is not necessarily in correlation to what the consumer or the patient is going through. And so that's why I share within this webinar of the key takeaway for anybody approaching this with a consumer mindset is to start with that mindset, to look again outside in as to where some paperwork is either superfluous, redundant, or marginally beneficial to the issues at hand, in ways of turning that into part of the service design that allows it to be ultimately minimized, if not reduced and eliminated in some cases. I know on the second part of this question, there were comments of the interconnected nature of the ecosystem, and some folks that are part of the service delivery chain, so to speak, may not be as modern. And in those cases, there are ways to think creatively about how to minimize the impact of their ability to move at the same speed as you want to move for driving the kind of change that you're looking to drive. But always start with the consumer mindset and what the patient is experiencing in practical terms in their lens, not yours, to then pinpoint where those opportunities and challenges are to attack.
Well, thank you, Todd, and thank you for these questions. If you have additional questions, please feel free to reach out to us. I want to again thank Michael O'Neill and Todd Strickler for joining us, and thank you for everyone who joined us online. This concludes our webinar. In just a moment, you'll see a survey pop up on your screen requesting your feedback on today's presentation. Be on the lookout over the coming days for a link to the webinar recording. Have a great day. You may now disconnect.